An unusual daytime encounter on Vancouver Island turned deadly for 21-year-old Nick Major. A normally nocturnal bat essentially ran into his hand.
Didn't think much of it at the time, and several weeks later, about 6 weeks later, started having symptoms.
By then, it was too late. Major died here at St. Paul's Hospital in Vancouver Saturday.
The challenge with bats is they have very small teeth, and even a minute scratch or bite sometimes is not even apparent, and it clearly in this case was enough to transmit the virus.
Friends say the popular Parksville martial arts instructor encountered the bat in Tofino. This is the 26th rabies-related death of a person in Canada since reporting began in 1924. Most fatalities occurring in Quebec and Ontario. This is just the second rabies death in BC. Bats are the only known rabies carrier in BC. The disease is transmitted through the saliva or blood of an infected animal.
Across Canada, there are several animals that are known to carry rabies, and the classic ones in Canada are bats, foxes, skunks, and raccoons.
The infectious disease specialist says it's important to seek treatment quickly after coming into contact.
The virus can get into the body, and it travels up through the peripheral nerves closer and closer and closer to the brain. And when it gets to the brain, it causes a very profound inflammatory response and a very profound inflammatory infection of the brain, and it's fatal about 100% of the time.
Doctors say Major symptoms progressed very quickly. It was only after he mentioned he came into contact with a bat that he was actually tested for rabies, the test confirming something so rare. At that point, nothing more could be done to save the young man's life. Anita Bath, CBC News, Vancouver.
Now let's underscore that last point, that deadly exposure to rabies in Canada is exceedingly rare. But because of that very fact, maybe you have some questions. I mean, we certainly did. So we've asked Dr. Alison McGeer to join us. You're an infectious disease specialist and a clinician scientist within Sinai Health System, so thanks for joining us here. The shocking thing about this case is that it was a seemingly benign interaction, and yet even that can lead to an infection.
Well, and that's one of the hard things about bats, because, you know, we think about rabies as coming from dogs, where if you get a dog bite, it's really obvious. Right. But bats have very small teeth and really small claws, and it's easy to have a break in the skin that you don't even recognize.
But then how are you supposed to even know if you can't even recognize that it's happened?
Well, so the first important thing is don't touch bats. You have to have contact with the bat. It's not something that's, you know, through the air or sprayed. So you want to bat-proof your house. You want to make sure that you don't ever come into contact with a bat. But if you do, right, that's what the professionals are for. So you need to find your physician and public health unit, somebody who can assess it and say, yes, you need to worry about it, or no, you don't, so that you make sure you get the vaccine in time.
And so in a manner of speaking, you should, assume that you have or may have contracted rabies if you've had that physical contact, because otherwise, what? I mean, if symptoms start to show...
If once symptoms start to show, it's too late. You really need, within the first few days after the exposure, to have the vaccine and the immune globulins. So now, you're not most of the time, you won't have been exposed to rabies, right, but you do need to have somebody who's got experience, who knows what the issues are, to be able to go through it with you and think carefully about it and make a decision about whether or not you need to worry.
Good advice. Dr. McGeer, thanks so much.
Pleasure.